the similar way the Tesla car says when you go in the rain, that now please take over manually. I cannot operate even though the road is good. So that will be the same scenario which comes in AI. There will be some scenarios where AI cannot give you the correct diagnosis or the correct answer. So human verification will always be there.
So doctors, now AI can read reports, suggest treatments, diagnose matters, do everything. Then what will be the role of doctors? So welcome to Dr. Parth Patel's. We would love to know what will be the role of the doctor in futures.
So first of all, AI
can do everything.
Yeah. So AI is able to read and all that is fine. But first AI will need clinical data along with basic reports or images or cards or anything. And that data will be provided by doctors because they need to generate a database which has a sufficient sample size to rule out any errors like alpha errors or beta errors. So that is the first role. Second role is sometimes in comprehension due to not just the quality of the images, due to ambiguous diagnosis, due to some abnormalities coming in, AI cannot sometimes give you the correct diagnosis or the similar way the Tesla car says when you go in the rain, that now please take over manually. I cannot operate even though the road is good. So that will be the same scenario which comes in AI. There will be some scenarios where AI cannot give you the correct diagnosis or the correct answers. So human verification will always be there. Plus, no matter what shape AI takes, it will never be able to completely replace a licensed doctor in that approval and legal process, at least not as of now.
In what matter or what segment doctor role will improve after the AI becoming?
So the first change which will happen is that the speed with which the doctor sees, analyzes and treats will always increase. Because as I showed in my presentation, that sometimes seeing an X-ray, then telling the patient और ये करा के लाओ, then फिर नहीं इसका भी जरूरत है ये करा के लाओ. AI can integrate it all at once, and that time will be shortened to a very big extent. The second thing it can do is it can identify errors which are missed by the naked eye. Our eye has limitations, and sometimes after a certain age, the anatomical limitations also set in. So that can be offset. And the third thing which AI will do, that it will automate things for the doctor. Like let's say a patient calls you and says he has a fever of 102. That patient will never be guided to just take a paracetamol and sit home. He will always be guided that you need urgent care, go to the doctor and get yourself treated. So that automation, that precision and that freeing of time will increase the lifestyle satisfaction of the doctor and will increase in speed in seeing patients.
So the doctor who is not adapting the right now technology, I see many doctors, even basic CMR software also they are not adapting. So how, what kind of opportunity they will miss who will not adapt the technology and who will adapt the technology? What will be the different after over a 5 year, 10 years?
So the first thing that will change is that if you don't have an EHR, the records have to be maintained manually. It can be lost, it can be torn, anything can happen. When you have an EHR, the moment the patient comes for follow-up, you have previous records, you can just have templates made. So first of all, they'll miss out on speed. Second, they will also miss out on error-free prescriptions. That EHRs usually are error-free and they have generic molecules written. So that safety aspect will be missed by people not using it. And the third is, as we go still a step further, that EHRs are easy to summarize. Manual histories can be missed. So that doctor will miss out on good patient satisfaction in the future if they don't use EHR.
Good. So what medical colleges is not preparing to a young doctors when will come to market, he have to face. So in your context, what must be prepared before coming to market?
So in the curriculum of MBBS and other courses itself, AI literacy has to be put in along with financial literacy, which is coming in. The second thing which needs to change is your viewpoint at seeing people coming with some questions which are generated with AI, because the more the doctor uses AI, the patient uses as well. So you need to be ready with answers which are generated by questions of AI in the minds of the people. So that is the second thing which doctors are not trained. And the third thing doctors are not trained is looking at all data at once. Like when you read one subject of anatomy, you are stuck in that phase. You read anatomy, you pass an exam, it's done. Then you read physiology, you read it, pass it, done. But today it has to be integrated all in one. So I think that integration is not currently very generalized in medical colleges, but which will play a big role in tomorrow's day and age.
So if one medical college student who is pursuing his doctorate, what one or two skills beyond clinical skills he must learn before putting his clinic or
So
hospital?
before, first of all, he needs to question himself whether he needs a clinic or no. Second, he needs to have financial planning and financial literacy.
Mhm.
If you put the burden of earning on seeing patients, then you miss out on excellence. This is what usually happens. The medical profession is not a business the way the corporates have made it. It should be back to the noble profession it was. So medical practice is passion, and you can only follow your passion when you have enough funds.
Mhm.
So financial literacy is one. Second, AI literacy, and along with AI literacy, there comes a literacy or the comfort with mobiles, computers, and other electronic devices. So that has to go. And the third thing which they have to overcome is the barrier in their head. कि हूँ लकीस नहीं तो याद नहीं रहे. If I don't see a physical sheet, I can't read. So that also has to go. So evolution in their mindset is what is the most important.
So my next is how digital tools can improve doctor-patient relationship. That one scenario, like no doctor who's not using, they are missing opportunity. However, doctor who's using the digital tools, how doctor-patient relationship can improve.
So let's say I have a patient who has been operated a month back and is now fit to fly. Is just calling me up that I need a fit to fly certificate. If I'm not using an EHR, I need to call him. I need to write it down. I need to sign in, stamp it. If I have an EHR, I'll just generate that. I'll just speak or I'll just type it. Generate a fit to fly for this patient. It's done. It's sent to his phone. So automation is missed. The second thing which they miss is retention of data. If a patient comes for follow-up, as I said, if we have our history and if no drug needs to be changed, we can just write or copy the prescription which was given the last time. So doctors will miss out on seeing more patients in the same time because you only have 24 hours. So I think speed and patient ease is what they will miss out on.
So I'll come to my last questions. If a doctor who is starting practice right now in the present era of Gen Z and Gen Alpha, so what fundamental things he have to prepare, which will help him in a future decades or futures, maybe 10 years, 20 years, will be the baseline of his career or his life professionally.
As I said that medical practice is for passion. It should not be your only point where you earn. So financial diversity and then comes automation. So please embrace AI or automation or tech wherever it comes because that will play a huge role 5 years down the line. It will differentiate you from your colleagues and you from your peers. And plus it will add to patient satisfaction 5 years down the line when Gen Zs and Gen Alphas become your patients as they acquire more illnesses the moment they grow. So if you keep this in mind right now, you will have lesser problems later.
So role of or importance of doctors is going to be more in the futures or a less last panel.
No, it will be there. It will never go completely.
Its efficiency will going to increase.
Yes, efficiency will definitely rise. Plus, for minimal illnesses, you might not need to always physically see a doctor. That age might come. But the role and the importance of doctors will never decrease completely. AI is there to augment a doctor, not to replace it.
So my last quote from you, the what message you will suggest in a quote or the what kind of doctor will thrive in futures.
So the doctor who becomes free to do whatever he loves due to AI,
Okay.
rather than the doctor who becomes busier than before due to AI will thrive. Because AI was born to make our lives easy,
So
not
if we
complicated.
summarize this word, the doctors who will use AI will be a more powerful or
Yes, the doctors who integrate AI, tech, and some other things in their day-to-day
Okay.
life will be having an edge over the others.
age over the other. So thank you, doctor, for joining this
Thank
and
you.
sharing this knowledge with doctor community.